Hello and welcome to Arab Health Week 2021. I'm Dave Sharp and I'll be your host and moderator for the next couple of days. On the third day, my colleague Sandra Garlick will be taking over. But for the next couple of days, I'll be guiding you through the program, and what a program we've got for you. Now, this is a perfect opportunity for you to collaborate, to learn, to innovate, to connect with all of your colleagues, not just in the United Arab Emirates and beyond, but worldwide. We've got people joining from all over. So you can chat using the chat box, which is there on the right hand side. And of course, for our speakers, you can ask them a question. So all you need to do is click on that Q&A, pop your question in there. You'll see other questions as well. If there's one that you really like the look of course, you can vote on it. It'll nudge it up. And that way we'll make sure that those questions get asked after the presentation. So if you want to chat to each other, say hello. Tell us where you are, what the weather's like, and what you're doing, what you hope to get from the next 2 or 3 days, and just generally network. This platform provides you with a fantastic opportunity to connect with each other. But of course, you can also come off the platform later on when the event is finished and connect on social media as well. To do that, we suggest that you use the hashtag Arab Health Week. You'll find that hashtag on Facebook, on Instagram, on Twitter, on LinkedIn. And by following that hashtag, you'll be able to find each other, keep the conversation going, and keep sharing best practice ideas and all of the other things associated with this fantastic few days that we've got for you. There is another hashtag as well, which is Health Week Series, because this is just one in a series of events. So you can use that one as well and stay connected over the next few months. So let's take a little look at what's coming up this morning. We'll have very shortly Sumit Puri, who'll be talking about health tech, keeping up the momentum post-COVID. He's our first session speaker. And then later on, we'll be going to Dr. Farida, and she'll be talking about shaping the healthcare sector in United Arab Emirates. Dr. Farida Al Hassani will be with us. So why don't we just get on with the show, as it were? I mentioned there our first speaker is Sumit Puri. Sumit is going to be talking about the momentum that we need to keep up post-COVID. He is the Chief Group Technology Officer from the Evercare Group, and here's his presentation.
Good morning, everyone. I'm Sumit Puri here, from Evercare Group CTO, and I'm basically here to talk to you about health tech, maintaining the momentum post-COVID. The key agenda, the consumer age. We all understand how the world has changed in front of us over the last year and a half. What is the need of the hour? What should be our strategy going forward, especially when we talk about healthcare institutions? How does typical institutions, traditional institutions transform themselves? How do we really engage the consumer differently? And what are the learnings I have had in my journey over the last several years on this? So again, moving on, if I look at really this age of the consumer, this is really, in some sense, a very difficult time for healthcare. We all understand the pressure we are in, huge amount of demand for services, shortage of beds, many developing countries, shortage of vaccines, huge challenges. And at the end of it, the consumer is actually expecting more. He wants us to be responsive. He wants us to be in many ways efficient, effective, balancing safety with convenience. That clearly is the need of the hour. And for us, we do get a little bit more kind of a difficult situation with the fact that now we also have Dr. Google to assist the consumer. Sometimes the patient knows more than the doctor, at least he believes to know more. And then it complicates, the life of a doctor when he's trying to advise him on certain things. So it's a tough environment. And the overall kind of expectation is to really work in harmony, work in conjunction to help us solve this complex, environment. So it is about building a consumer insights-driven organization. It's about understanding the business value, how we could really leverage technology, how do we differentiate our services, how do we really become much more effective at reaching out at some point, in fact, reaching out to consumers before they have to reach out to us. How do we really enhance overall experience? I think that's the need of the hour. If you look at the consumer focus, and I'll just go back to one slide just for reference, the patient has become the new center of gravity. And hospitals are just one of the many providers in the ecosystem. So you actually have now care which is virtual. We have people working from home now. We actually have home care happening. You have a lot of ancillary services that are coming in, pharmacy delivered at home, wellness clinics coming up. There are rehabilitation centers, huge amount of focus that's now happening on the entire ecosystem. And the patients are informed, they're savvy, they watch social media, they see what is happening there. A lot more, word of mouth publicity that basically can impact the reputation of our healthcare institution very rapidly. Now, how quickly we can go down. In that sense, it is about convenience, it is about reduced cost, it's about improved outcomes, it's about enhancing processes and personalized care. It is about making that consumer feel important, making the consumer know that we are doing the best for him. And that to me is important. In many ways, if you look at the environment today, we are flooded with data. There are massive amount of healthcare data being generated at multiple sources. And if you consider the top 5 companies in the world today are all data companies, Amazon, Google, Facebook, all these key companies, they all basically are leveraging data to enhance the consumer experience. They're really making sure that we can consume that data and then they further, personalize that experience to us. And that's what healthcare institutions have to do. We are the cusp of a revolution, a cusp of changing the way healthcare is delivered to the consumer. And that is what we need to kind of orient ourselves towards, because only those who basically are able to do this will survive. It is going to be a very, very tough battle for survival as we go forward into the coming decade. So again, if I look at the real objectives here, we do need to have a connected, coordinated, and integrated ecosystem with the patient in the center. You're talking about possibly connected devices, wearable devices, which can be portable. You're talking portable insulin pumps. You could also have, internally embedded medical devices like a pacemaker. You could have, various ways in which you could also further assist the hospital services, by just, kind of staying connected with patients while they're at home. There's a huge amount of work that could be done with telehealth, really kind of having the doctor reach out to you, reach you in your homes, in the comfort of your homes, without you having to basically step out to an infection-prone environment, outside your homes. So there is a huge focus now on integrating this entire ecosystem. And for that, we've seen, there will be a need for more out-of-hospital digital services. It will basically be a lot more of self-management along with the doctor and, of course, the hospital institutions, kind of combining to create that integrated care, that continuum of care for the patient. And to us, the key proposition for any healthcare institution is to establish quality with convenience, quality support, quality protocols, ensuring that is done along with continuity of care, where the silos start getting to come together and you reach out to the consumer where he needs you. In some sense, if you look at the home healthcare, 70% of healthcare needs can be met at home with 30% better recovery. It's only the tertiary and quaternary care that needs to be done in the multi-speciality hospitals. Of course, you need to follow protocols. Of course, you need to be very, very well, integrated and engaged. The doctors and the nurses or the paramedics engaged with your recovery path. But 70% of healthcare needs can be met. And frankly, almost 20 to 50% lower cost of treatments if we consider the treatment to happen at homes versus the hospital. We know that there is a significant amount of negative backlash that comes to us when we basically are not able to offer that convenience, the kind of waiting times that we basically have consumers, have to undergo. They are busy, they have multiple things on their mind. And if they're made to wait for a discharge, made to wait to get admitted, made to wait to basically even see a doctor, it does have an impact. 82% of patients, after one bad experience, we've seen, research has shown, do not sometimes visit that institution again. Now, these are scary numbers. We have to be in some ways a hospital with a difference, healthcare institution with a difference, because the patient is basically expecting treatment like what they expect in a typical hospitality sector, which is very tough because the healthcare institutions are on strain. That's where technology has to come in to really enhance the value, enhance the kind of reach, enhance the kind of access, enhance the protocols for enhancing the quality of care. There is a lot of confidence of global market trends. We all see the state of mental health with COVID, even without COVID, by the way. If you look at, a couple of years back, we had a study from WHO which said by the 2030, 1 in 3 people are likely to get clinically depressed because of the stress we live under. COVID has only, in some ways, even further aggravated that risk. We do need to also look at some unspecified, subtle kind of indicators to help enhance the wellness of those patients. But before the patients, I think even more important is your own employees, because an employee-centric strategy will lead to patient-centric strategy. If you look at nurses, you look at doctors, you have to have them in the right state of mind. High attrition rates in nurses, we've seen what damage it could cause to the patient care. In many countries, we've seen almost 40 to 50, 55% attrition in nurses. Same, if you look at even doctors, they are under huge strain. And they do also want some level of respite from the constant barrage of pressure and criticism that they are subjected to. Of course, if I look at the bright side, telehealth adoption is on the rise. We are able to make some more headway. And I have seen myself, in the last couple of years, we were pushing doctors to embrace technology, over the last few years, and we did not see too much traction. But now, what I've seen, in fact, in the last almost a year, 6 months, besides, we actually have doctors chasing us to get, onto the telehealth platform, because they want to be connected to the patients. They want to reach out. And to me, that's a plus, because we can obviously then leverage this to enhance the quality of data which the patients can provide us to help us offer better treatments to them. There's significant opportunity that exists if you're able to leverage these technologies for the betterment of the patient care. So it's about the marriage of people, process, and technology, which would really help us enhance the quality of care. Again, if you look at it, frankly, patients are not only the ones that come to the hospital. We are also talking about potentially healthy patients, which could slide into that kind of patients requiring surgical interventions. You have lifestyle-related diseases that have gone up tremendously over the last few years. So it's not about what is on the surface. It's also basically digging deep within to enhance wellness, to provide continuum of care. I think enabling holistic and integrated healing, that's what is required. And multiple aspects involved there. Mental health, psychologists kind of coming together, nutrition, wellness packages, personalized treatments, a lot of things which need to come together to really enhance that quality of relationship with the consumer. And in some sense, it's also important that we consider that this will be kind of, in a ways, added to, if you look at the overall, way it is basically interspersed with SMAC, with, multiple aspects that are basically happening, the social media, the mobility, the kind of things that we are seeing in front of us with cloud and analytics. There's a lot of work that's basically happening outside what you typically see. Because, even the interaction we have with the consumer, we only sometimes see one interaction we've seen in the hospital. There might have been interaction with the consumer in the call center. There could have been an interaction maybe, at a clinic. And of course, on social media, we don't really know what all has basically gone into that engagement of the consumer. There is a lot of growing use of mobile devices. There's a significant amount of tech-savvy patients that are coming to the fore. We are now talking about the digital natives, people who basically have grown up on technology, not the old, people who basically have been forced, not the digital immigrants or, of course, the digital illiterates. It's the new technology-savvy patients who basically will kind of come to the fore over the coming decades, over the coming years. And we have to be ready for that. And we have to embrace technology. Work with technology, not become its slave, but work with it to actually enhance that experience. And this, to me, is what would actually help you to stand out in the mind of the consumer. Of course, IoT applications, the way we basically are leveraging, the AI is also going to play a part. But we know that these all trends need to basically converge for the betterment of the patient care. If we see this over the next 10 to 15 years, we do see a lot of focus on productivity, but slowly but surely, we will start moving towards more value, consumer-centric healthcare ecosystems, cutting-edge health orchestrators who will actually help consumers coordinate and convene. Frankly, I don't even see the competition for hospitals coming from hospitals itself, healthcare institutions coming only from hospitals. You might have huge competition coming from the likes of Google, coming from the likes of Amazon. They are really kind of trying to use the data to reach out to the consumer in a totally differentiated and personalized manner. And we have to orchestrate, given the fact that we have doctors, we have a body of knowledge on the consumers. We have to start, putting it together, creating a much more integrated experience. What I have seen, and I must say this, in my previous role at Max Healthcare, we actually saw, the IBM India head came to me and said, "I'm not going to leave Max ever." And I said, "Why?" He said, "Look, the last 15 years, my entire family, my mother, my wife, my children, myself, we're all basically having the complete medical records with you. And that's what probably, will make me keep coming back to you. Because you know me, you understand me." I think that's what we need to get to. At Evercare also, we're doing the same. We're basically trying to create that personalized experience to really, be able to connect to the consumer, understand him better. And that's what we really need to do going forward. So the problem, as we know, from an individual consumer standpoint, it's lack of private access, lack of instant access. They are looking at convenience. They are looking at now, the service to be provided to them. Limited choice of services that they see in front of them. They don't know whom to go to. There's also a significant amount of siloed approach. They might have multiple, conditions, but typically we only see one specialist. If you have a kidney problem or also a heart problem, you would typically will not be advised, that holistic treatment. You do need to go to two different specialists who might give you conflicting medicine. And that's a problem, many ways. We also are seeing higher cost of services, much more diagnostics being done, which are unnecessary sometimes. Of course, there is a lot of precaution that hospital institutions take to help you, help enhance that patient safety. But it is something which is difficult to do. It's a balance which you have to constantly strive for. And with the paucity of time, that becomes difficult for a doctor and a healthcare institution. So from a provider perspective, we all know we need to enhance client experience. We all want to ensure improved outcomes. We'd like to, scale the business, in some sense, where you can reach out beyond your hub, move out to spokes, to smaller centers, and, get the specialist to, connect with the patient. And of course, reduce your cost. So these are all real issues which the industry, which the healthcare institutions are grappling with at this point. So the need of the hour, clearly, is for a solution that's holistic, that's preventive, and that's universal. Much more personalized. It offers a much more integrated way in which we can treat the person. It is about the person. It is about the consumer. And we need to put all these things together and focus on wellness, focus on prevention, not only on the cure, because that comes later. If you're able to build a relationship for life with the consumer, with his family, they will not go anywhere. You will always have the share of the wallet. But you have to start investing in that relationship to create something which is basically a co-created journey, for the patient. And technology today is what could help you in that journey. We've seen the kind of expectation that patients have about service quality and efficiency. We've seen the need for accountability and transparency from the regulatory agencies, the demand for clinical data. Every time I keep hearing from my doctors, I need more data to enhance my treatment protocols. And I keep telling them, if you enter data, you will get quality outcomes. If you enter quality data, you will get the right outcomes, right information, right MIS. If you don't enter data, whether it is in e-prescription or it is in the electronic health record systems, you might have a problem in ultimately getting the kind of MIS, the kind of research information that you really want. And that's where there is a partnership required. There is a need to kind of look at overall, the investor's viewpoint. We have to also balance that with the patient's interest, because that's critical. We have to ensure patient is still at the center. But at the same time, the interests of other stakeholders are balanced. And the key thing here is to get those insights at the right time. Real-time analytics wherever possible, or at least the timely analytics which is required to enhance the quality of our decisions. Again, if I look at the technology innovations, multiple technologies currently at play. You have so much that's currently happening, so many innovations that are happening. They're simply still not, in a way, connecting together. We're not kind of still having some level of integration done with these amazing innovations. But the time is not too far before we will see, somebody taking the lead and bringing these together. We've got teleophthalmology, we've got mobile ventilators, we've got multiple, robotics also now coming to in a big way. Huge amount of innovation that's happening on robotics. Of course, now mind-controlled wheelchairs. We've got these innovations from individuals. Once institutions come together, research institutions that are already working today. I mean, if you look at, frankly, even the COVID times, the two companies that really in some ways transformed the vaccination were startups in a way, biotech and Moderna, which supplemented the pharmaceutical big majors. And that's the need of the hour, to balance agility with the kind of traditional body of knowledge we already have, to balance that and create a holistic whole, kind of really a line of treatment which will assist the consumer in a faster recovery. Industry trends, we have to become more customer centric. We have to optimize. We have to adapt to the context. We need to be sure this is what would work for you. In Evercare, for example, we actually had, when we were doing the telehealth solutions, in multiple countries, we launched the telehealth solution for India, Pakistan, Bangladesh, Nigeria, Kenya. We saw there was a difference in what worked well in certain geographies. Not everybody, it's not one size fits all. In Kenya, there was a bandwidth issue. When we launched the same platform, we did it very quickly, by the way. But there was need to, make it more adaptable to the context, make it work for them. Bangladesh, we had amazing teamwork. We saw huge traction. In fact, our OPD volumes with teleconsult remained almost constant after the first 1 or 2 months of COVID because of telehealth coming together in conjunction with the hospital teams. Same to some extent for India. But we did have some challenges in some of the other geographies like Kenya or, for that matter, Pakistan or Nigeria, which was just coming up that time. But I think we have to make it suited to the context. Horses for courses. I think that's important because that's what will help you get the traction from the consumer. And the focus on prevention and holistic wellness, besides just the curative care, because that's what builds relationships, in many ways. So there has to be a focus on the ecosystem. We have to make sure that these aspects come together. The customers, our partners, selecting the right partners, getting the right things, getting the right devices. We've done bike ambulances which had point of care diagnostics, which actually allowed patient, to be, in fact, of the bike ambulance to reach the patient in 15 minutes, in Max, for example, and we could save lives. The point of care diagnostics was so important and had to be accurate because, information is being looked at by a command center, by the clinical team, besides, of course, the operational team, which are helping them in the logistics, making sure that they can reach the hospital in time. But those things, those devices also need to be clinical grade, need to be, reliable, and they need to come together. And of course, our employees who are at the center, make sure they are connected, they are engaged, they're fully, owning some of these aspects, because only then will the actual experience be enhanced. And all of this needs to be done with a very robust data and analytics platform, which is so critical to be able to do some course corrections as required as we go along. Because it's important. Sometimes you might make a mistake, but then as long as you can correct it while the patient is in hospital, that's the best thing that can happen. We don't want those unhappy customers to go out, and announce various, issues on the social media when this problem could have been addressed very quickly while he was still in hospital. And that's something which is doable. It's possible. There are some small mistakes that can be quickly corrected because healthcare institutions are under pressure and they actually handle a lot. So some simple, aspects, some simple nudges in the right direction using analytics, could really enhance both the delivery of care and also the experience of the consumer. So to really kind of look at this, how do we really get all this together? We will need to do things differently. We will need to lead people differently. We need to build platforms differently. We need to buy our products or services differently, select the partners differently. You might actually look at multidisciplinary teams to enable integrate care across specialties. We have to start looking at all these aspects to be actually working in harmony, working synergistically with each other, because only then will be able to provide personalized care to that patient. So in some sense, and I'm borrowing this, from Gartner, it actually says we need to look at composable healthcare thinking. We need to really look at what do we need to do in terms of much wider communication and engagement activities to bring our teams together. We have to evaluate where experience needs to change, because unless the people, process, and technology are working, synergistically, you will not get the full impact. So you have to review the current portfolio. What are we doing? How do we change? How do we enhance? And this will be possible by forming fusion teams. In some ways, it's about breaking the walls of departments. You actually have to bring them together. You actually need to create teams that are focused on consumer centricity, creating a team which is focused on consumer experience, really looking at specific aspects that need to be improved, and obviously corrections that need to be done in that journey without their own siloed objectives, whether it's finance or it is legal or it is IT or it is operations. We need to come together to really create a really strong, robust, solid experience for the consumer. And in some sense, this can be done by actually having a command center. We saw this happening in bike ambulance, for example, where we had a command center. We are seeing this in the home care that we are launching, at Evercare, which is basically about looking at all information together in a very seamless manner, which transfers information from various spokes, and you're then creating a very strong protocol to deliver care. So integrating these aspects of people, process, systems, making sure all of them basically understand the objectives, the people understand the objectives, understand the metrics, and continuously refine the process, and obviously deploy the right system, because we have to ensure from a system standpoint we do have all the necessary MIS available to these teams to measure themselves, and if they measure, they will definitely manage. They will definitely be able to improve as we go forward. So a shared culture, shared ownership, where IT delivers value in partnership with clinicians and the operations team. We are looking at really creating shared goals, because that's what will give you the real impact, real benefits. It's not us versus them. It's all of us together, where IT needs to play a significant role, but it has to work in conjunction with the clinicians and with the operations and other employees, other support functions, to deliver the best possible experience to the consumer. It's about coaching teams. It's about creating that learning culture. It's about making it some level of empowerment, enabling digital literacy. It's also about being patient with the nurses, for example. When somebody comes in new and maybe they might have a language problem, you might need to have a buddy to help her. You might need to have a small e-learning platform which could help the nurse understand the protocols. You might have a simulation center, which could be used to enhance the quality of the training. Maybe a normal kind of skilled nurse could become an ICU trained nurse with with some level of simulation training and some level of patience, some level of hand holding with the senior nurses or the doctors. It has to be done together. As Stephen Hawking says, intelligence is the ability to adapt to change, and change we see all around us. Today, working from home has become a reality. Today, we know telehealth is not going away. It will stay. It will be more and more popular as we go forward. We know there will need to be a lot more integrated, personalized treatments given in a contactless manner. We don't want too much of contacts to happen given the risk of infections and all of that. So we have to adapt. We have to change smartly. I mean, today, if you look at, there is a lot more intelligence in our smartphones that what we used to ever have as an individual. And we have to leverage that intelligence from wherever we basically feel there is value and make it come together. Enhance the quality of training, enhance the quality of literacy, and be a little patient in terms of bringing them up together to improve customer experience. So add those e-learning modules, give them some 5-minute nuggets, the concept videos, enhance the classroom trainings if required. We can do a hybrid model where the classroom trainings can be supplemented with e-learning and some practice sessions which at their own pace. Those aspects are critical because healthcare institutions need to be supported by the government, by the regulators, by, of course, the consumers. They are under pressure. And we do need to support them as healthcare administrators so that they can really kind of, be able to provide the best quality of care without getting too stressed, during that process. So again, if I look at the key aspect here, it is about employee platforms. It is about enhancing collaboration. It is about alignment, understanding those metrics, understanding the challenges or concerns they have and addressing them, and making sure that we basically are clear about the goals, about the key objectives of each function or each of the overall enterprise on certain aspects, whether it is patient safety, whether it is convenience, also from our perspective, costs, because we do need to bring down costs, we do need to enhance quality, we do need to also enhance and improve convenience, but it has to be done in a manner that basically works synergistically across, and not at the cost of the employee, of the employee well-being. We do need to also take care of that employee who's working so hard, 2 shifts sometimes, more than that, to help take care of those patients, the doctors and the nurses who are doing a phenomenal job in all this. So use that platforms, to kind of help you make some necessary changes or corrections as required to enhance the quality of well-being of our employees. The essential of today's digital business is, of course, managing the diverse workforce. It is about being agile. It is about managing compliance. It's adapting to new technologies, whether it's cloud or it is automation or new IT, IoT devices, and also controlling cost. That, to me, is a tough ask, but it can be done if we are able to follow a very graded, very sequential, or some ways, well phased out path towards digital health. We have to manage that transition in some level of with some level of care. We look at how technology can supplement, how we can basically get the people and process to come together. We have workshops, we have discussions, we create some integrated teams, which will then help you in enhancing that quality of care. So that's, to me, critical, because we do need a lot more alignment, a lot more discussions, a lot more workshops, which would really be extremely important as we really create a world-class experience for our consumer. GCC countries and UAE, there's a lot of possibilities. There's so much that's working for you. There's so much that basically is kind of is good about the infrastructure we have. We have a fair amount of technology savvy consumers. There are good quality doctors. We are trying to make sure that we can bring all these things together and partake of this journey in a manner that is achievable. We have set short-term goals. We do have a long-term roadmap in mind, but we set short-term goals and basically try and work towards achieving them with clear metrics, which would really be useful as we kind of undertake this journey. So in some sense, when we even look at the overall expectation from our hospital managements, we would like to basically able to have a 360 view of the customer. What interaction he's having, how the call center interacted with him, what kind of engagement did he have with the sales teams, or what happened during the interaction that they had in the hospital front office or the billing counter. We have to, in some ways, make our patients our fans. We have to, in some ways, build a relationship, enhance that loyalty, clearly become, the institution of choice for our consumer, for our customer, for our patient. Not only patient, by the way, it's also the attendant, because most of the experience is also experienced, as actually also seen by the attendant. The patient is sometimes too, kind of stressed about his treatment, and the actual service is more kind of observed by the attendant. So we have to look at these aspects carefully, and sometimes, make sure that those corrections can happen while the patient is still in the hospital. Or of course, even if it's, let's say, home care, we're able to basically then make those improvements in our protocols, even at home if necessary. So again, this is a important element in terms of tracking the key metrics, tracking those touch points, which would help us enhance the overall experience. So we do need to think about a BI unit, business intelligence unit, that can help us capture the data on operational excellence, on clinical excellence, on our financial efficiency, because ultimately the costs need to be managed. I mean, hospitals will need to basically also ensure that the bottom line is in order. So we have to look at all these aspects, and getting near real-time insights is really the key to ensuring much more sustained and much more profitable business results, because that will help everybody, including the consumer. We will want it to be a very healthy institution and cut down costs where are not necessary, obviously enhance patient experience, reduce the kind of time that they are having to spend in the hospital, the ALOS, the average length of stays, use the assets more optimally. Maybe, somewhere we actually look at different models as well, operating models. Those are areas that can be looked at. Even excess inventory can be, kind of reduced by having right insights. We can actually look at readmissions. What are the reasons? How do I enhance the quality of care or cut down on my medication errors? What happened? How do I really kind of at least look at Pareto analysis saying the top 20% issues that happened last month, let's make sure those 20% are solved. Those are key areas, which we could probably explore, which could actually enhance the entire, continuum of care, for the patient. And of course, like I said, also it might be useful for, the families, extended families, and, the entire ecosystem around them. So I'll not spend too much time. There are various metrics we could look at on operational efficiency, the supply chain, the experience of our staff, experience of our patients. How do you ensure that those aspects are properly tracked and monitored and necessary corrections made? We could look at the turnaround times, for discharge, etc. Clinical excellence, also need to start measuring outcomes. Very important that we know what we did right and what we did wrong. Sometimes we might go wrong. And it's fine to basically, get that understanding so that we can correct it next time around. I mean, that's what at least I do in my team. I say it's fine to make a mistake sometimes. We're all human, but as long as we don't repeat it, or at least do our best not to repeat it, we are fine. There has to be a culture of acceptance for people to bring out an issue that happened and make it, really, better, make the whole process better, make the entire protocols better. That's only happening with a culture of acceptance. So work on those. Start measuring it properly, and then I'm sure there is going to be improvements seen across sectors, across the spectrum. And if we have the right data, if you're following standards, whether it is ICD-10 for diagnostics or it is CPT for procedures or any of that, you will start seeing data playing a key role, technology playing a key role, AI, as we mentioned, frankly, smartphones, they're so smart today. You look at Google, Dr. Google, you have so much that could be basically, collated in the intelligence of a million doctors, is actually in your smartphone. So vis-a-vis, let's say, one single doctor, you could have that augmenting the doctor. You could look at personalized, precision health. You could look at, a much better genomics, mapping. You look at, various ways in which we could probably assist, the consumer in his analysis, in his diagnostics. There are various aspects that will come together when you actually have the proper smart use of data, following the right standards. And it's important that we have some of the insights coming at the right time, which we can then leverage. If you look at just a high-level snapshot, of some possible uses of AI in healthcare, they're actually saying that you could clearly, in many of these aspects, you look at it, they say, of course, you could, actually reduce 8% of your healthcare expenditures by predicting and measuring, monitoring patient outcomes. You could optimize your staffing by almost 30% if you do a good job of knowing where the additional resources are put and where you probably have slack. You actually have overworked nurses. There are nursing rostering systems. You might have some places where a nurse is looking at 10 patients per nurse, and some might be quite free. They didn't get a patient the whole day. So there has to be optimization of resources or resource allocation, and same for assets, the biomedical equipment, etc. So AI can help you get that understanding, get to those insights. Similar to that, augmenting diagnosis. Doctors do not have time to spend on going through every single symptom you had over the last 50 years, 40 years, 20 years. You basically been facing a particular chronic condition. But you could assist them. You could use AI to enter this information in the system, and the AI algorithm could help give some predictions on these possible diagnoses, which the doctor can use. It is augmenting the doctor. It's not replacing him. But you could really do a huge job. They're saying 30 to 70% cost savings can happen if you reduce the prescribing of ineffective drugs. Just the diagnosis was correct. Obviously we had a fair amount of support provided to the doctor at the time of diagnosis, at the time he was seeing the patient in OPD. So you already had some information that was entered by the patient, and the doctor was able to then quickly make up his mind on what should be the line of treatment. And of course, we could automate various intervention mechanisms, and obviously make it a lot more personalized with a lot more focus on what would be the best treatment protocols. So again, there is significant opportunities in this entire journey which can be leveraged across. Now, if I look at basically the way we can use AI, there are areas we actually have significant opportunities again which are actually available. Now, if I look at the way we actually have used AI also in spend analytics, we could use the AI for improving the procurements. We could use AI for enhancing the kind of time that the patient is spending in terms of his waiting times, etc. We enhance the quality of care in certain specific touch points. There are now devices that can actually assist you in image analytics, AI and radiology. We've done so many pilots. They're excellent. I remember I went to a conference in Amsterdam a few years back, and they was mentioning almost 85% accuracy in AI on radiology. Just that the remaining 15%, some of it was very wrong, which is why the radiologists were still not willing to use it fully. So it just requires some level of training, some level of hand-holding by correcting those errors and making the machine understand, the machine learning algorithm understand what needs to be changed. A typical radiologist looks at 70% accuracy. The machine is already giving you 85%. We could leverage this. We could enhance this by giving the right training, by giving the right guidance to that machine, and the algorithms. And I'm sure the overall kind of efficacy will improve for everyone. The cost will reduce, and obviously the diagnosis and the actual treatment will improve. And now we see a lot more of this bots and conversational AI coming to the forefront for engaging consumers. Because sometimes we see patients do not actually feed this information if it's not a very serious issue. You'll probably find a gynae, let's say, expecting mother very willingly feed all the information you need. You'll find, a heart patient entering all the information you need, or a cancer patient, but maybe not so much diabetic guy. He will not enter the diet he took because it's not that engaging. Now there are tools that can help you enhance that engagement, make it simpler, make it easier. It is about the experience. It is about design. It is about intuitive interfaces. Making sure that the patient, the consumer, is able to engage with the technology in the way he does, let's say, an iPhone. Make it easy. Make it actually, useful for him, and obviously, the right kind of insights, right kind of information that he can understand. And the same thing goes for the doctors. I mean, Babylon and many others of these technologies. they're all augmenting the doctor. They're making the patient enter information, and that's what helps the doctor, get much better diagnosis. I mean, we've seen the third largest cause of deaths is the wrong diagnosis, which is sometimes done because of paucity of time. With bots, with conversational AI, you can actually improve that significantly. It's very, very possible, and we just need to work together to leverage technology in the right manner. So with all this, I think we can really create a longitudinal patient record. We can actually create a complete ecosystem, complete 360 view of the customer from a patient's DNA all the way to their consumption and lifestyle habits, which would help us partner with them in their wellness journey. We create an ecosystem, we create a wellness kind of ecosystem that actually makes the customer being our consumer for life. We actually kind of really create that bond, that relationship, which enhances the way we basically interface with our consumers. So to me, it's about technology, it's about the process, and it is about the people coming together and making really the consumer at the center of all the delivery models that we typically give them. And that's how the entire ecosystem, the entire healthcare delivery model will transform and become a lot more useful, a lot more sustainable, a lot more happier for the consumer. Aspect I just like to highlight here is the key learnings also, which I think I kind of wanted to mention just from all the last several years that I've actually had experiences in various hospitals. It is about standardizing, the protocol, standardizing also the kind of procedures and diagnosis that we do. It's about collaborating as per context, horses for courses. In some ways, it's about ensuring that there's a very adaptive and iterative culture of innovation. So you might actually have separate design teams which work together. Like I said, employees who are engaged. You might have a mixed, kind of team, which also, gets some of these upstarts, some new college graduates, some really tech, wizards to come in and partner your traditional teams to create that culture of innovation and embrace that culture of innovation. It's about outside and patient-centric design. Partner with startups, get the startups to work on the design. Maybe the traditional IT companies might not be experts at the user experience. Use the startups to help you in the experience aspects, in the UI UX. Make sure that adoption is the key. You measure what you actually have delivered. Is it being adopted or not? So there's strong governance that actually comes in, which will help you in terms of enhancing the patient experience. So in some sense, it is about creating a lot more focus on what users or consumers will actually start using, start consuming, start embracing, and creating your processes, creating your employee kind of interactions to that context, and make sure that you basically are in this journey for the long term. You create a culture, you create a culture of partnership with your employees and of course with your consumers, and enhance the quality of healthcare delivery. So that's all from my side. Thank you again for the patience.
And I'm delighted to say that Sumit joins us now for some questions. Hello, Sumit. How are you today?
Very good. Good morning, Dave.
I have to say that was a very positive and hopeful outlook that you've painted there. But we do have some questions that will perhaps test you a little. You speak about bringing these partners together, about innovation, about the potential for the future. But is the funding and the supply chain there? Does it exist, or do we need to build that, or is it robust in some areas and not so in others?
I think we will need to build a lot of this, and this can be done collaboratively with the right set of partners. So I think it's a journey. We will need to kind of engage with these partners, engage with some of our key stakeholders, and then co-create it. I think that is, to me, the key.
And do you think that there are partners? I mean, you mentioned some of the startups. There's some partners that you would like to see at the table that currently are being ignored or aren't being consulted?
Yes, I would think, again, like we all know, change is scary sometimes. We don't want to, look at moving out of our comfort zones. Sometimes, we realize that there is value in different way of thinking. We look at, I think I'm mentioning this, we look at in the COVID vaccination also, two startups, Moderna and Biotech. They were the ones who, in a way, took the leap of faith and kind of, helped co-create the vaccine with the traditional, powerhouses like Pfizer, etc. But I'm saying it's important to partner, with some of these innovative, companies, and obviously give them the benefit of your data, the benefit of all your insights that you've accumulated over the years, and then create a very powerful, kind of offering for the consumer. So it is about knowing what probably would be the most appropriate kind of using and kind of partnerships that we might have to forge, and then create something which is basically of value to the consumer. So I would say that no, we have to be open-minded about these partnerships.
And not only the partnerships, but of course the tech. I mean, you spend a lot of time talking about the technology and the potential for technology to be part of the solution. But of course, that can be fraught with danger as well. The tech doesn't always work. You've got to measure. You kept making that point about measurement and data. How do you trust the data? Presumably, we have to measure over the long term.
Absolutely. I'm saying tech is not magic. We can leverage tech the way we want to. The smartphone can be a boon and also a curse. We know the challenges, we actually have with it. You don't have a spare time and all. But I really feel, we do need to understand that digital transformation is basically about not just technology. It is about process. It is about people. We have to kind of understand the various moving parts and bring them together. Sometimes it's easy to blame the tech. We feel tech is the panacea for all problems. It can solve everything. It needs support of the people. Even to train tech, even to train an AI engine, you will need training. You will need to, kind of partner with it. So I would just say it's important that we kind of understand these aspects and then, kind of do this, iteratively and collaboratively to deliver the best value.
And of course, there are some challenges with tech, with cybersecurity particularly. What do you see as needing to be in place to make sure that data and the tech is protected?
Look, there has to be a proper incident response. We know the kind of cybersecurity threats that are emerging across the globe. There will obviously be protection that we can enhance and, obviously, mitigate the risks as such. Network security, our endpoint security, all of those, those are there. But you might get hacked. We all know. The saying is 50% of people know they're hacked, but the other 50% don't. Something or the other has happened, with the growing, army of cyber attackers and stuff. What I would really encourage and recommend is focusing on incident response, quick and effective incident response. You will have an incident, but you should be coming out of it very quickly and effectively. That's what the focus should be. And get those key people together who can understand the challenge and quickly address it. That to me is most important. So work on your defenses. At the same time, ensure your incident response is very quick, very effective, and very pronounced.
Well, as I said, as we came into the Q&A there, you're very upbeat, very positive about the future. It's good to hear. As I mentioned there, you can catch up again and watch that if you want to. Lots of detail on the Future Health YouTube channel. Coming up, of course, we have plenty more throughout the day. Our next session is Shaping the Healthcare Sector in United Arab Emirates. That's with Dr. Farida Al-Hassani. That comes up just before 11 o'clock. So join us for that. And remember, if you're on social media, LinkedIn, Twitter, Facebook, Instagram, do please use the hashtag and connect with each other. The hashtag is, of course, Arab Health Week. So we'll be back shortly. See you then. Welcome back to Arab Health Week 2021. I'm Dave Sharp, your host and moderator for today. We've still got plenty coming up, which we'll announce to you later. Remember, this is your event. Take part, you can chat, you can ask questions, and of course, you can connect with each other. A fantastic opportunity for you to build relationships and create a brilliant community for healthcare professionals. So if you want to continue the chat, of course, we are on social media today, Twitter, Instagram, Facebook, LinkedIn, using the hashtag Arab Health Week. That's all you need to know, and you can keep that conversation going. So up next is Dr. Farida Al-Hassani. Now, sadly, Dr. Farida couldn't be with us today, but she did put a presentation together for us. It's all about shaping the health sector in the United Arab Emirates. Dr. Farida Al-Hassani is from the Abu Dhabi Department of Health. She sent us this presentation. You can watch it on Catch Up later as well. Unfortunately, there won't be any questions for her, but it's a fascinating insight. Please welcome Dr. Farida.
Greetings. Good afternoon, everyone. This is Dr. Farida Al-Hassani from Abu Dhabi Center of Public Health. I'm really glad to be with you today to share and to shed the light about the future insights of healthcare sector in United Arab Emirates. I will focus within my domain of experience related to public health and the different experience dealing with COVID-19 pandemic in the last 2.5 years. So during this presentation, I will cover, I will talk about the patient care transformation and how we are foreseeing the future of the patient care transformation based on the changes that are evolving with time very rapidly in Abu Dhabi and in United Arab Emirates and globally as well. There has been a lot of trends that could give us some insights of what's going on within the patient care experience. In addition, I will talk about the reshaping of health research and what are the changes that are going on within the public health domain, and sharing some of the programs and experiences that we had in terms of the transformation of the public health programs within the Emirate of Abu Dhabi. And we will talk also about the evidence-based policy decision when it comes to how we are designing our different indicators to be able to monitor what is going on within the healthcare sector, but also within the population health in general, to have a better understanding of the needs of the community and how we can better serve our community and adapt to the changes that are going on. We will talk also about the utilization of big data and data integration, and what are the examples of health and non-health integration that can help the health sector to perform better in terms of understanding the patient's needs. And also, in addition to that, we will talk about the link between health and non-health information. COVID-19, since the beginning of the pandemic, it has really changed a lot in our lives and in the way we are working and dealing with others. And in the healthcare sector, it has a huge change in the way we are delivering the services and the way we are thinking about our patients' health and needs and care. So during the pandemic, our strategic main focus was to minimize the disease impact. When we talk about the disease impact, it means that we were working to ensure that the reduction of the mortality, to reduce the fatalities that are caused by the disease. In addition, during the pandemic, communication was a key issue. So during the pandemic, there has been a lot of focus on how to engage with our community and how to educate them about the public health measures and the interventions that they can take to protect their lives and protect the lives of others. In addition, we had to work in the capacity building, because with the surge in the number of the cases that were rapid, very rapid in certain point of times, in certain geographical locations, the adaptation of the healthcare services was very hard. And this caused a disaster and crisis in certain countries because they could not cope with the requirements of the patients. In addition, the other dimension was the business continuity and how we could really continue to provide the essential services, including chronic health diseases, including vaccination, including emergency care for other patients who are coming for other reasons other than COVID. So how we could really work to ensure that we could deliver those services despite all the huge demands that were created because of the COVID-19 pandemic. One of the major important focus areas that we had is we were dealing with a new disease that we didn't know about before. So research and innovation was very crucial because we want to really expand in our services and we want to learn more about the disease to be able to fight it. So research was a critical part of our response. And for all of those areas, you could see that technology and AI played a major role on this. Being able to cope very rapidly with the patient's need, with the human resources demands, with the services that are required, we had to think differently. So this challenge that we faced brought us more closer to the future by quicker adaptation of technology and innovation to ensure that we are continuing to provide the care required for our patients and the care required for our community. So patient care transformation has different trends that are going across the world. One of the things that we even talked about before COVID-19 was the telemedicine. Although it has been moving, but it was slowly, the COVID-19 pandemic forced us to think differently and try to adapt technologies much quicker than we will do that. So this challenge created chances that we can really adapt to the changes that we need to ensure that we are talking to the patient. So the challenge we had during COVID-19 in terms of reaching patients, especially elderly patients who are difficult to move or they are high risk of getting the infection, we had to keep them in the home, but provide the care remotely using different means, whether it's a teleconference or a video conference with the doctor, in order to ensure there is a continuous follow-up. And although in the beginning doctors were resistant to those technologies, we could see that the adaptation was very fast. And I will share you some of the studies that has been done in UAE to assess the doctor's attitude regarding telemedicine and what are the opportunities that we have. In addition, the portable diagnosis and using mobile or other portable means for diagnosis of certain conditions have been really dramatically evolving with time. And we could see a lot of new diagnostics that came to the market that help the doctors to monitor the patient status or to diagnose the patient much quicker. One of them, for example, the example shown here is using mobiles to monitor ECG changes, electrogram, the electrodiagram that can give us indication about what's going on within the patient health without the need for the patient to be in the hospital or in the clinic to do the ECG. In addition, you could see also things that were invented recently that can help to monitor the patient progress regardless where he is, whether he is inside the country or outside the country. Example of that, the use of modern technologies using mobile applications to track patients with diabetes, with any other health conditions that we are caring about as well, especially the chronic conditions that require continuous monitoring and evaluation. Another trend that has also dramatically changed is going to change even more in the future is the use of home care services. We started a couple of years back with providing home care services for elderly population or people who have difficulty to be mobilized. But currently, home care services is a core service that is provided, whether it's for routine vaccination, for diagnosis, for follow-up of patients, for post-operative care. So it is a really wide variety of services that can be provided while the patient in his home. And this will minimize, it has a lot of benefits. One of it is to minimize the infection that might be acquired during the patient's stay in the hospital, and having a better convenience and improving the patient experience when he is getting the care needed while he is in his home with his family members. So those are 4 trends that are changing and evolving with time. But also it's important to monitor how effective we can use those and how they can enhance, whether it's the patient experience, patient management, and the patient outcome. So evaluation of those trends, continuous evaluation and continuous developments of those dimensions is very important, because it can help us to shape the future of how we can deliver the healthcare to our patients. Moving to next slide, this is a paper that was research that has been conducted in UAE, in Abu Dhabi specifically, talking about the experience of doctors on handling the telemedicine, whether it's a video conference or teleconference at different specialties. And we could see that it has been used for in different specialties, such internal medicine, family medicine, and some other specialties as well. The main results of this study indicate that video consultation should be adapted frequently in the new remote clinical consultations. You could see that the previous experience with telemedicine was associated with a twofold confidence in treating acute conditions and less than a half of the perceived risk of misdiagnosis. So the telemedicine is really improving, and the confidence of doctors on using the telemedicine in different specialties is increasing with time. And it increased the ability to provide the patient with health education and enhancing the physician-patient rapport. In addition, these results shows that the audio consultations are equivalent to video consultations in providing remote follow-up care to the patient with chronic conditions. These findings definitely are very important for the policymakers and for the program leads because it will have many benefits in different countries, especially countries with very high difficulty to provide clinics in remote areas, and also improving the patient access by reaching to their homes or through a mobile application or through mobile. Moving to public health, major areas of transformation are going on, and we could see that the delivery of different programs have been really dramatically transformed, and we are expecting the use of technology more and more in the future. For example, in communicable diseases, we shifted from the manual reporting to integrated dashboard that is linked with the patient electronic record. So in most of the previous cases, we had the physicians have to report filling a form. We shifted from that into electronic system that need to be filled again by the doctor, but eventually we are shifting to an integrated system that will not add any burden to the doctor. So once he entered that diagnosis in the system, automatically it can be reported. And again, there are many applications that has been added to the control programs. Example, we had the video follow-up, VOT, video observed treatment for TB. So we could follow the patients with TB and make sure that they are continuing their medications throughout the period of 6 months or 1 year, so we have a better control of tuberculosis disease. In chronic diseases, we also shifted from doing and conducting researches to understand the burden of different chronic diseases such as cancer, diabetes, or asthma, or many other conditions such as obesity, for example, in children. We used to conduct researches that will require 2 or 3 years efforts to understand what's going on. Now we have a better understanding of different population indicators, including continuous information about what is the burden of different chronic diseases in the community. And this could help us as public health practitioners to save time from collection of the data to move more into action-focused interventions. We could see also a major transformation in the awareness and the education of different public health programs. The use of social media to monitor population attitude, population's perceptions, and also the use of the social media platforms and the different technologies to educate and provide the information about how people empower people about how they can protect their health, how they can improve their health. So changing people's behavior, which is a continuous challenge for all public health leads across the world, is really changing as well. And we need to adapt to the new technologies in order to be able to drive a healthy behavior to our community. So we could see a lot of trends going on when it comes to the use of mobile applications or other means of technology that can help people to adopt a more healthy lifestyle. When it comes also to infectious diseases, one of the important things that is changing and evolving very quickly since 2020 is how we are using the big data to understand and predict more about what could happen in the outbreak. And I will talk in more details about our experience and global experience in using of different modeling, such as the use of modeling to understand what's the expected numbers of beds required for patients in the upcoming period. And this is basically using different information that we have about the disease. For example, what is the length of the what is the transmission speed of the infection, who are the close contacts, and what is the rate of the transmission for every individual. Different informations related to the behavior of people, such as if there is a lockdown, the mobility of the people, which is again some of the informations that are available publicly, but also other behaviors like, for example, the opening of borders, especially the airlines, and how could this impact any disease condition, especially the infectious diseases that can be transmitted from one country to another. So we could see that many models have been used and adapted by different countries to have a better understanding of their disease epidemiology at this stage, but also using the epidemiological and clinical information that are available in order to try to help the future planning when it comes to the beds capacity or the policy decisions to be taken during any outbreak. So this is a live example of how each country used the modeling, and those are some of the publications that are available on how they use the modeling to predict and to have a better understanding of the disease of COVID-19. But this is also a trend that we will see in the future, that we will have to develop and learn and adapt to those changes and ensure that we are trying those methodologies and knowing their pros and cons to be able to use it in any future pandemic. Sharing a local example, we worked with UAE University to develop our own model using age-structured modeling of COVID-19. And this was last year in March and April 2020, when we worked closely with a group of researchers from UAE University to try to understand what's going on within COVID and what is the increase expected in the upcoming period. Our experience in this is we had to develop our own model because the epidemiology of the disease is different from one country to another. There are many determinants that are changing and evolving with time. At that time, our important difference from any other countries is we had a large number of labor workers that need to be considered in the model. So we had to split the model into two groups. We had to split the population into two groups. The workers, labor workers, and others from the residents and nationals. And the big differences between those two groups is labor workers had to live in a more condensed population. So taking in consideration that one case could affect many others in the same living area or the work area where there is a lot of condensity compared to UAE nationals or residents who live in their homes with a less exposure when it comes to numbers. So predicting this difference is very important and help us to have a better understanding of what could happen, what is the worst case scenario, and what is the best case scenario that could happen in the prediction for the next period. Where are we now from the modeling? I think this was a very rich experience on how we could use technology and use the data. At a certain point of time, we had to add additional publicly available information, such as, for example, Google mobility data, to see how did the, for example, lockdown affected our country or any other countries when it comes to the disease prediction. We are currently working to develop further this model to include new determinants that came in 2021, such as the vaccination and how this could affect the disease prevalence, what is the possibility of the reinfection, what is the expected severity, because the severity of the disease even changed from last year. If we compare the wave that we had last year in March, April, it's very, very different from what we could see in March, April this year. So counting for those differences is very important to ensure that our model is accurate. So we are currently working to really update the model and also include the changes that are happening within the spread of the infection and its changes related to the variants, different variants that are reported from across the world. So this has been very useful experience. However, we foresee that the dependence on the predictioning in the future and the use of the big data, whether it's really, for this example, we used health-related data such as disease prevalence and risk factors related to the patients, and we used also non-health data related to the people's behavior, such as movement, going to work, going to school, going for shopping, for example, and how could those behaviors change how the disease is evident in the community. The other area that is really evolving is research and the way we are conducting research. Coming from academic background and continuing to participate actively in the research for communicable diseases in UAE, I believe that there has been dramatic changes to the way we conduct research here in UAE and across the world. We used to have a slower rhythm of collection of data and analysis, but the pandemic and the challenges that we faced required a different way of work, especially when it comes to research, how we could expedite research very quickly to ensure that we are really getting enough evidence that can help us to shape and change the policies and adapt with the pandemic. So currently there is a registry that you can see and to identify all the different researches that are currently going on in United Arab Emirates. The DOH, Department of Health, registry that has capture of most of the studies going on in UAE. In addition, we had to develop our own data collection methods to understand what are the trends, what are the research trends going across the world, what are the areas of focus across the world when it comes to research. So being able to understand the global trends of research, but also participating in the research, trying to close some of the knowledge gaps that are available and support the international community through different researches that are conducted in United Arab Emirates. And fortunately, we have lots of researchers that came from UAE, and we could see also many clinical trials that have been started. So this is a new era of research that we will have to be different from what we used to be. For UAE, it was totally different, a new era, because we never started the clinical trials. But now we are really very actively participating in different clinical trials. There are at least 4 clinical trials that are currently going on to learn more about vaccines or different medications that are used for COVID-19. With this, I will end with the last slide, which is talking about the future directions. I think the area of the infectious diseases and the emerging infections is a huge area of development and focus in the upcoming period. So the current challenges that we are facing today are great opportunities to prepare us for the future. So we need to think beyond the disease and beyond the pandemic, how we could be more prepared for the future. So just to summarize, I think we will have to focus more on identifying gap in information and knowledge and trying to participate actively in the research going on, whether it's related to COVID-19 pandemic or any future emerging infection. Also, the way we are conducting researches, epidemiological researches, we need to have innovative ways of conducting contact tracing, for example, using a merger between the traditional methods that we are using and also new technologies that can help us to be more efficient, quicker, and get better results. So the use of technology and AI in health is not an option. It's currently a must. So we should really continue to explore what are the potentials of the different programs that we have, how can we develop, how we can evaluate the new methodologies and validate them to ensure that we are adapting the best of care services in United Arab Emirates. And the last thing is really we need to be more prepared for the future pandemic. healthcare readiness and infrastructure. There has been many lessons learned from COVID pandemic that we should not miss and we should use to be more prepared for the future. With that, I end my presentation. Thank you.
Thank you to Dr. Farida Al-Hassani for a valuable and helpful and fascinating insights there. What a lovely line that is. Current challenges prepare us for the opportunities ahead. We've got to be prepared. Nice little line to finish on. Remember, you can watch that presentation again on the Future Health YouTube channel, and you can stay in touch with us via the hashtag on social media, which is Arab Health Week. So let's take a little look at what's coming up for the remainder of today's event. So we'll be taking a little break shortly, but we'll be coming back later on with Sophie Smith. Sophie is the co-founder and CEO of NABTA Health, and she'll be looking at the topic of public-private partnerships and integrated models of healthcare in the GCC region. And she'll be followed by David Boucher. David will be talking about the importance of digitization and service excellence for medical value travel consumers. David is the Chief of Service Excellence at Astra DM Healthcare. Both brilliant presentations. They're coming up after this break. Remember, you can carry on networking, connecting, and sharing good practice in the chat and throughout this excellent platform. We're here for full 3 days. There's still plenty more to come. So we'll be back after this break in around about 45 minutes. See you then. Welcome back to Arab Health Week 2021 with me, Dave Sharp, your host and moderator for today. Coming up, we have Sophie Smith, but just to tell you a little bit more about what to do to get involved, of course, you can connect with other participants on this amazing platform. Use the Q&A to ask a question of any of our presenters, and also the chat. Tell us where you are. The whole idea of today is to build a community of health professionals, not just in your region, our region, but also worldwide. A great opportunity to share best practice, to innovate, to come up with ideas and to partner with others. The whole idea of today is to keep the momentum going. We're here for today, tomorrow, and a third day, but also on social media. We have a hashtag running, which is Arab Health Week, which is available on all platforms, Twitter, Instagram, Facebook, you know the score, LinkedIn. So stay in touch with each other, keep the conversations going, and let's create that brilliant community. So coming up, you can ask questions of our next presenter, who is Sophie Smith. She is the co-founder and CEO of NABTA Health, and he's here to talk about the private and public partnerships and integrated models of healthcare in the GCC region. Let's take a look at the presentation.
Good afternoon, ladies and gentlemen. Salam alaikum. My name is Sophie Smith. I'm the co-founder and CEO of NABTA Health. And today I am going to be talking to you about public-private partnerships and integrated models of healthcare in the GCC region. We will do a quick dive on some of the public-private partnership opportunities in the region. We will look at a case study that's come out of the UAE for an integrated model of care. And then we will explore some of the opportunities and best practices in PPPs from around the world and places where these could be implemented here in the GCC. First off, I'm going to give a very, very brief introduction to NABTA Health and what we do. In short, we provide personalized healthcare to women using a new model of hybrid healthcare, which is effectively an integrated model of care based on the combination of digital and traditional healthcare along clinical pathways to improve specific sets of health outcomes in women. We are data-driven and powered by machine learning. And we are also patient-centric and patient-led, or as you'll see with the wording from one of our case studies, human-centric. Today, we are trusted by women across the Middle East, Africa, and South Asia. We've served over 25 million women with health awareness campaigns. We have about 275,000 women who are active on our platform, have access to goal-aligned, non-communicable disease-oriented health and wellness recommendations. And we work with a wide variety of local partners that span the women's healthcare and more holistic health and wellness spaces. And this is one of the reasons why I was very excited to present to you on the subject of public-private partnerships and integrated models of care, because I believe that with our globally emergent digital economy, really coherent public-private partnerships will be the key to advancements across all sectors, particularly in healthcare and education. So in terms of opportunities for public-private partnerships in the GCC region, I'm going to begin by looking a little bit at the objective of the of governments and of the public sector here. Ultimately, the GCC is looking to establish itself as a global hub for medical tourism. What this means has changed slightly in flavor since the COVID-19 pandemic. Previously, a hub for medical tourism might have been perceived as an exclusively physical or in-person thing. Now there are many more virtual and remote care options available. And so the nature of being a hub for medical tourism has changed. It's now not just about the quality of the facilities and the kind of concierge services that are provided. It's about providing care that is really in a class of its own in terms of being evidence-based, value-based, patient-centric, research-led, and accessible to populations from emerging markets and beyond. So what does building this global hub for medical tourism mean to the GCC? Well, it means investing into specialized facilities or centers of excellence that employ value and risk-based care models. It means becoming leaders in the diagnosis, treatment and rehabilitation of chronic diseases, which are very prevalent here. Over a quarter of the population, most of the GCC countries, adult population, suffer with diabetes or other metabolic disorders, and almost half of the adult population is overweight or obese. It also means becoming a virtual and in-person medical tourism hub for underserved markets. And these could be emerging markets, so lower income countries across the Middle East, Africa, and South Asia. It could also mean much more established markets like China, where the ratio of people to doctors is very high. So you might have one doctor for several thousand individuals. The result of this being long wait times, lack of access, and ultimately lack of trust in the healthcare ecosystem. I believe there are kind of three core opportunities for public-private partnerships based on the overarching objective of healthcare sectors or healthcare ecosystem in the region. The first is centers of excellence, and this is an opportunity that is driven by the chronic disease burden, a burden that increasingly is shifting from public to private sectors as the care requirement is seen as more specialized and less general. 80% of beds in public healthcare facilities across the GCC are at capacity, according to a study that was done in 2016. And while there are steps being taken to address this, for example, in Saudi Arabia, where we see the rollout of multiple locally controlled accountable care organizations, the lack of beds to deal with the growing chronic disease burden is problematic. Today, 70% of rehabilitation patients for chronic diseases travel abroad for treatment. So there's a massive outflow of individuals who could quite comfortably be treated here in the region. And the same thing is true of local clinical talent. So if more centers of excellence are established, more specialized facilities attached to university hospitals, attached to opportunities for R&D and publication, we should see a greater retention of local clinical talent. And as a result of that, greater investment into and trust in the GCC as a hub for medical tourism. The second major opportunity for public-private partnerships is in home and remote care, driven by the aging population and really facilitated by the COVID-19 pandemic. And this is the same story for healthcare systems around the world. The virtual consultation providers, so in the Middle East, people like TrueDoc, people like Atibi, people like Virtual Health have seen a 500% plus increase in virtual consultations during the pandemic. Many at the peak experienced over a 1,000% demand for telehealth support, and this is settled still at probably 500% of pre-pandemic rates. So although one of the overarching drivers for home and remote care is a growing and aging population, the pandemic has facilitated this and has made it more second nature for individuals who are looking for different care options. Home and remote care is also being facilitated region-wide by massive investments into advanced technologies and fast 5G connectivity, so accessing video consultations, accessing quite complex data sets, accessing machine learning powered symptom triage, which requires multiple API calls, etc. All these things are being supported by very fast mobile internet connections and speeds. Like I said, there's an increased demand from an aging population in the GCC and also rapid growth. Bahrain is expecting to almost double its population between 2016 and 2030. There's a very youthful population, but it's also a population that from the age of 45 onwards is largely expected to develop one chronic disease or another. So the fact that there is a rapidly growing population means that the chronic disease burden is also expected to increase, and so there must be more options for care outside of traditional healthcare facilities than exist today. One of the other outcomes of the pandemic is that we've seen growing support for personal therapy and employee mental health programs. Mental health, like infertility and other hereditary conditions in the MENA region, considered very much taboo pre-pandemic, and now with many people working remotely and from home or coming to the office a couple of days a week, maintaining employee engagement and productivity has been tied increasingly to stable and personalized options for both physical and mental support from home. So home and remote care is another major opportunity for private sector companies who are looking to establish partnerships with public sector here. The third and final opportunity that I'm going to give is for medical manufacturing. So this is for the manufacturing of biopharmaceutical products and also for medical disposables. And one of the key drivers for this is the need to maintain and improve population security, another outcome of the pandemic. During the COVID-19 pandemic, we have seen global biopharmaceutical supply chains threatened. We've seen the distribution of vaccinations, for example, disrupted, large-scale wastage in terms of, or hold-ups in terms of distribution of personal protective equipment, vaccines even passing expiry dates or going bad because they have been stored in facilities that don't meet their stabilizing requirements. And all this is resulting in a desire to support the development of more localized, dedicated biotech facilities and incubator programs, a desire to invest into R&D, partnerships that can support the ecosystem from the ground up and act as a solid base for medical tourism. Only 7% of medical disposables and limited pharmaceuticals are manufactured locally today, but we're seeing pending trade deals for local manufacturing facilities, for example, for the vaccine, for whole genome sequencing with private sector companies from around the world. And again, this is all driven by a desire to increase and safeguard population security. So those are three key opportunities for public-private partnerships in the GCC. I'm now going to give you an example of an integrated model of care. This is a kind of flagship project out of the UAE, and that is GluCare, which offers next generation diabetes care using an integrated care model. Again, in the realm of public-private partnerships, these increasingly integrated models of care that allow the seamless connection of patients to, or of individuals to different providers in a network, that allow comprehensive and protected data flows are going to be rapidly emergent and are rapidly emerging across the GCC. So GluCare has a number of key features associated with it. It's very much a pioneering project in the GCC. It uses an integrated model of care that takes a more holistic approach to the management of diabetes than purely traditional care models, with multi-clinician inputs into tailored diabetes management programs that are supported by a hybrid healthcare model, so combining the best of digital and traditional care, facilitating home and remote care. They use continuous data monitoring that is initiated through the distribution of a starter kit to individuals, which includes a mobile app, wearable band, and then a number of other connected devices on a needs-only basis. GluCare is one of the first organizations in the region to use targeted digital therapeutics Prescription digital therapeutics are relatively new to the market globally. Targeted digital therapeutics, very new to the GCC, and these provide personalized insights, risk factors, and recommendations provided through real-time data analysis. The way that GluCare is set up, so enabling more touch points, more remote touch points, facilitating low-cost access in real time, allows all of its resources in-house and in clinic to be more effectively optimized, thereby reducing the cost of care provision for both the provider and for the patient. It's a human-centric model of care, very much centered around the individual and their data and their interactions with the various touch points that they're given, whether it's a mobile app, access to specific clinicians and other Internet of Things devices. And the objective of GluCare is to enable more meaningful, impactful and supportive connections with patients, as well as obviously improving health outcomes. And they use a comprehensive partner network. So again, I think when we talk about public-private partnerships, and I'll come back to this when I give some examples of best practice models from around the world, we're not just talking about interactions between one public or between the public sector and one private sector company. We're talking about an interoperability that is enabled from a digital infrastructure perspective that allows multiple partners, along with public sector entities, to interact together. Just a few statistics from GluCare. So with their 90-day pilot, they saw an average HbA1c reduction of 1.7% points over 90 days, just a 1% reduction, which is what was achieved or what has been achieved by various other kind of market-leading entities around the world, has been shown to drastically reduce the likelihood of developing additional complications and other chronic diseases later on in life. A 4.7% average reduction in total body weight, 25% average reduction in low-density lipoproteins, so the bad form of cholesterol, 53 times more patient engagement with educational content. And this is important because if you're building a human-centric model of care, there is an assumption of a substantial educational component that allows them to be at the epicenter of their care. 14 times more weight and BMI data points analyzed. So a lot of data analysis, patient centricity at the core of the model, and integrated in terms of the interactions of multiple partners for the provision of care. Next, as mentioned before, I'm going to actually look at some public-private partnership best practice examples from around the world, and a number of key takeaways, each of which is different, each of which showcases the opportunities for public-private partnerships and their development and implementation here in the region. So I'm going to start by looking at the UK, and specifically looking at the UK in the context of its response to COVID-19, which has seen a massive overhaul in the method and model of interactions between public sector, so between NHS England and third-party contractors. So some of the highlights during the COVID-19 pandemic, and this is as reported by CBI last year, 579 contracts were awarded by central government to combat the pandemic. Of those, just over one half were awarded to new suppliers. And these covered everything from location identification to the provision of e-prescriptions, to the provision of virtual consultations. The NHS typically, and we're going back maybe 10 or 12 years here, exclusively awarded public-private partnerships to large-scale entities for multi-million-dollar ticket sizes. Many of these contracts were much smaller, and many things about the process of allocating contracts changed during the pandemic, with phenomenal results, not just in terms of access to care, but also in terms of health outcomes. So one of the key examples was that in collaboration with a number of third parties, it took, when there were fears of ventilator shortages, 100 days to design and manufacture clinical grade ventilators from scratch, using third parties who had never manufactured medical equipment before. Some key takeaways, and these actually, there are four main principles, I guess, that are takeaways for public-private partnerships in the future, to widen the public sector market. So to have a more open-minded approach to developing, piloting, supporting partnerships between the public sector and new, particularly technology-enabled healthcare companies. That procurement processes can be simplified and must be simplified, and without any detrimental effects on either health outcomes or interoperability. Previously, the timelines for procurement with public sector were lengthy. These were shortened to months, and in some examples, weeks or even days, to meet critical care requirements of the UK population. That building strong supplier relationships and maintaining an open dialogue is important. I suppose that's a given, and that it's important to support innovation with an eye on future-proofing the digital infrastructure for the NHS, and also building long-term relationships. So for the UK, it took a pandemic to really revolutionize the way that it thought about public-private partnerships, but now with a myriad of healthcare companies, private sector healthcare companies supporting NHS operations, and the NHS is probably stronger than it has ever been before. The second example I wanted to give was of Estonia, which has been identified by Wired, among many other organizations, as the most advanced digital society in the world. This is applicable, actually, the key takeaways and insights, not just to the healthcare sector, but to public-private partnerships across industries. Some key highlights of the Estonian economy: 99% of state services are online, and 99% of Estonian residents have ID cards, of whom about 70% use them regularly, either through mobile or through digital methods. There are 2,600 plus services that can be used via X-Road. So X-Road is a massive connected database and digital infrastructure that allows the seamless interaction of and collection of data from public and private sector companies. Many of the transactions through X-Road are blockchain enabled and ledger based, but the digital infrastructure that has been built here, and it's one of the reasons why Estonia is reliably named in the top 5 in 2019 as number 1 on the Digital Health Index, is that it allows the seamless collaboration of public and private sector companies in the delivery of healthcare. And what this means for individuals is that they have access to their health data no matter where they go, no matter which providers they see, which obviously is one of the key things required for true human or patient centricity when it comes to the management of healthcare. The key takeaway here is that investing in a comprehensive digital infrastructure is key to supporting seamless collaboration between public and private sector companies, and having the individual, in terms of their identity, in terms of their access to data, having a very individual-centric approach is a key part of that. The last example I'm going to give is of Rwanda, which recently signed a 10-year partnership agreement with Babel, the Rwandan subsidiary of Babylon, to deliver virtual and remote care to its population. In an earlier pilot phase service offering, there were 2 million signups for Babel with a 98% patient success rate. The partnership was originally introduced to solve the problem of a 1 to 10,000 doctor to patient ratio. So there are about 12 million people in Rwanda, and there are thought to be about 1,200 specialists to attend to those 12 million patients. The takeaway from the Rwandan example is that long-term relationships between trusted private sector companies such as Babylon and the public sector can enable the complete overhaul of an entire industry. So Rwanda is one of the first countries to see the digitalization of its healthcare infrastructure end to end. It's one of the first countries around the world to make access to doctors, or remote access to doctors via virtual consultation standard. And this digitalization of the healthcare sector is now extending to multiple other areas of the economy, with significant kind of knock-on effects in terms of the efficacy of the national economy, in terms of safety, in terms of its prospects as a hub for tourism, for medical tourism in neighboring African countries, etc. So that is the third example of a country that has utilized or prioritized the introduction of public-private partnerships to its benefit. In conclusion, the GCC is rife with opportunities, not just for public-private partnerships, but in general. I've listed here 6 examples where private sector companies that are interested in establishing themselves in the GCC and wider emerging markets should be focusing, because there are gaps currently, but there's also significant growth. So the first of these is in B2B healthcare expansion. There's been significant investment in the last few years into digital infrastructure to support her remote care options. Many of the companies that have secured the largest venture capital funding rounds have been in the B2B healthcare space, whether Visita or Atibi, or even Babylon, which secured over $550 million of investment as part of its Series C, of which a significant portion came from the Public Investment Fund in Saudi Arabia. Consumer healthcare is relatively nascent here, but it's a sector that will grow rapidly. And so for companies looking for expansion opportunities, for opportunities to become more engaged with the public sector here, consumer healthcare is a sector that offers sizable first mover advantages. The Ministry of Health in the UAE has been very active in the last 12 months in terms of beginning to engage smaller private sector companies. It ran the Be Bold accelerator for youth empowerment last summer, which took kind of 15, 16 thought leaders from public and private sectors and had us all looking at ways in which we could introduce programs to materially improve the delivery of care in the UAE. It has now established an innovation community of practice, which continues that work. So looking at opportunities for public and private partnerships, looking at opportunities for innovation within the public sector to support the better delivery of care, UAE and then ultimately GCC wide. Another opportunity in the GCC region is in the establishment of specialized venture capital funds. At the moment, most of the VC funds in the region are very generalized, investing predominantly into e-commerce, marketplaces, logistics, and fintech. We have in the last 2 or 3 years seen more interest in establishing specialized funds either in fintech, ed tech, or in health tech. And there are definitely more opportunities here, especially as we see private sector companies coming from abroad to invest into R&D, to invest into public-private partnerships, who are looking for potential acquisitions or collaboration opportunities. The fourth opportunity is in R&D. Again, we've seen an increasing interest since the COVID-19 pandemic in the investment into R&D to support everything from medical manufacturing to care delivery across the UAE. There is a unique opportunity here in the GCC in terms of having consolidated healthcare data systems for diverse and largely underserved populations, which makes the GCC as a partner for research and development across the healthcare industry, whether in pharmaceuticals or in medical device manufacturing, a perfect partner. The establishment of grant funding mechanisms is another opportunity for private sector companies looking to establish a foothold in the region. There are an increasing number of local companies and also local entities supporting R&D out of universities that are dedicated and focused specifically on discovery and pre-commercialization phases of R&D. And there is a need for grant funding mechanisms to support these, and then for companies who are willing to support with the commercialization as companies exit the R&D phase as well. And the last major opportunity in the GCC for public-private partnerships is for entry into emerging markets. We at NABTA Health have always viewed the GCC as a springboard for the exploitation of untapped market opportunities in the Middle East, Africa, and South Asia. And exploitation is a strong word, but the underrepresentation of populations from these sectors historically, or from these countries, these parts of the world historically, can't be underestimated. 92% of clinical trials still occur in the US and in Europe, and the remaining 8% mostly occur in the Far East. We've seen time and time again, especially during the pandemic, how health outcomes from people in the Middle East, Africa, and South Asia have been worse compared to their white Caucasian counterparts. And so for companies who are looking for ways to establish additional revenue streams or strengthen, even diversify their existing product offerings, having a presence here in the GCC, collaborating with the public sector is an excellent way to start tapping some of the market opportunity that is the MEASA region. So that, from me, is it. We've had a look at opportunities or the objective behind a lot of the public-private partnerships that are happening in the GCC today. We've looked at 3 key examples of opportunities for public-private partnerships in the region. We've looked at one case study for an integrated care model that, with a drive to establish more specialized facilities, will, I'm certain, become more and more widespread over the course of this decade. And we have also looked at some of the best practice examples in terms of public-private partnerships from around the world. I'm Sophie Smith, co-founder and CEO of NABTA Health, and enjoy the rest of your afternoon.
And I'm delighted to say that Sophie joins us now. Good afternoon, Sophie. Thanks for that presentation. How are you today?
Good afternoon. I'm well, thank you. Better, in fact, I have to apologise for potentially sounding a little breathless during the presentation. I have been in the latent phase of labour for the last 5 days, and contractions pick up at night time. So that's the reason for the breathlessness.
Do you know, I did hear that. I wasn't going to mention it, but now that you brought it up, I mean, you are now going well beyond the call of duty to do your presentation. Join us here, which I think just shows you the dedication of people like yourself. Thanks for that. We've got some questions for you, Sophie. You mentioned the NHS in your presentation, one of the examples of best practice. One of our questions is, do you think that the NHS needs to use blockchain for a more seamless process?
I think there are a lot of questions asked about blockchain. It's been a kind of trendy topic here for the last couple of years. Blockchain, as with any other technology form, is an enabler ultimately. In the healthcare ecosystem, that means a better health outcomes. So I think blockchain has many potential applications and ways in which it can make care more patient or human-centric. For example, by allowing people to be in control of their own data, logging through a decentralized ledger any occasions on which they choose to share their data with third parties,
being notified of any onward sharing by third parties. It can support transactions, etc. But I think it depends on the specific health-related problems that the NHS and any other healthcare organisation is trying to solve, as to whether this is an applicable solution in that circumstance or not.
When you look at public-private partnerships, on paper they look like a brilliant combination and a great idea, but they can be quite clunky, can't they? I mean, I know that you mentioned that those processes have been speeded up and made a little bit more seamless, but in my experience, they can be, you know, the bidding process, the tendering process, you know, the meetings, you know, the private sector tends to be more agile and move more quickly than the public sector. How would you overcome those challenges, do you think?
Well, I think that's one of the things that we can see from the case studies coming out of the UK during the pandemic, has largely been overcome out of necessity. My father, until recently, was the National Clinical Director of Diagnostics for the NHS, and previously was one of the national leads for PACS, which is probably the NHS's first big digitalisation programme, certainly one of its most successful. And if you compare the procurement process for PACS to the procurement processes that have evolved during the pandemic, I mean, it's night and day. Granted, we are going back 16, 17 years now with PACS, but 592 contracts signed, over half of which were with new suppliers during the pandemic. And many of these companies are relatively young, you know, everybody from the likes of e-surgery, founded by a very lovely woman called Turia Wenbar, actually of Iraqi origin, and that does e-prescriptions to meet some of the demands of the NHS. Vine Health, which was an app set up by women, by a couple of female co-founders to support cancer patients with managing their chemotherapy and treatment. I mean, the NHS managed during the pandemic to pivot from an organisation with a notoriously clunky procurement process to one that was able to and continues to be able to interface with dozens of small companies in the private sector. I think it's an example of what we're capable of when necessity and demand meet, and the effect that it's had on the consumer healthcare and health tech ecosystem in the UK has been phenomenal. I think it's one of the things that I'm most hopeful for here in the UAE, that the example of the NHS and its kind of redefining of public-private partnerships and what they look like is something that could be emulated across the GCC, and the result would be, more diversification within the economy, would be a sudden explosion of consumer health tech companies that are regionally focused, solving regional problems. I think the whole point of going into entrepreneurship and building companies from scratch is that you believe change is not only possible but required. And I definitely think public-private partnerships are a space where there is that requirement for change.
And it definitely requires that creative thinking, doesn't it? I mean, a lot of people, the world just stopped around about a year ago, and then people got a little bit down, and then they started to think creatively. And there are some lovely examples, aren't there, of people who previously would have said, well, I have no, as you said in your presentation, experience of medical supplies or the healthcare sector. And yet, I have a friend of mine who went from shaving products to sanitizing products and selling them online. And then there's examples of people in my industry, in the events industry, who would normally be at exhibitions helping out. All of a sudden, they're doing the test and trace, so we have to be positive, but we have to be quick, don't we, in these situations, and think creatively outside of the box.
I agree. I think a growth mindset is very important, and I think putting blockers in place for the sake of it makes no sense. I also had a cousin actually who had been in the online tie and customized tie business. He had a lot of corporate clients, a lot of clients attached to events, and obviously when COVID hit, everybody started working from home. all of the events stopped. And he actually pivoted into an online sweet store, which I guess if you're a parent stuck at home with small children, as I am, as many are, could suddenly become something of a lifeline for you. And he found within weeks that they couldn't ship sweets out fast enough to meet the demands of the consumer. So I think having a growth mindset for yourself, being willing to embrace change, being willing to take steps to implement change are important. I also think if you're in the business of facilitation, be it in the public or the private sector, your job when you encounter somebody who wants to bring about change because they believe that there are better ways of doing things, your job is to get out of their way and to enable them as much as possible.
Yeah, and these partnerships, of course, previously people have worked in silos, the coming together and the joining of forces. It requires some investment, just in terms of money, but time and planning, doesn't it?
Yes, exactly. So we're part of the innovation community of practice with the Ministry of Health here in the UAE. And one of the discussions that we've been having is around how we can kind of facilitate that with MOH. So there's a system that MOH recently launched to allow employees to kind of submit ideas they have for process improvement and for the introduction of new products and services, etc. And what we want to do is support them in taking the next step, which is to link those ideas that have come from inside the organization to private sector companies that have products and services that can or are already turning those ideas into reality. Because I think what is often underestimated in healthcare and health tech is the amount of R&D that goes into building a serviceable product or service. Because if it's technology enabled, not only do you need to build the technology from scratch, there's often a machine learning or another kind of deep learning component to it. You also need to clinically validate it. So to turn and get an idea from the idea stage to kind of product market fit can take you 3 or 4, 7, 8 years of R&D. And so the more that you can be connecting people who have ideas to the people who have already done something about them, the better. The more that you can enable and accelerate change instead of always feeling like you have to build something from scratch yourselves.
Yeah, and we need to be sure and clear that those people that are bidding for contracts are thoroughly looked at, don't we? Because there've been other examples of companies that have just jumped on board. They've seen an opportunity, and sometimes they're not the best people to be to providing the services.
I agree, but then again, these mechanisms that are used to make sure that the evidence base is there from a clinical and technical perspective, to make sure that the proper processes in place, that the platforms are HIPAA and GDPR compliant, they're all there already. For a lot of it, from a compliance perspective, it is just a matter of plug and play. So again, I think creating a robust framework for very dynamic public-private partnerships is actually relatively straightforward. The greatest inhibitor to this, as with most things, is the mindset of the people involved.
Absolutely. Well, and we talk about mindset. I know you've got an incredibly positive, upbeat mindset, and that you see this as an opportunity that has come from a challenge. Sophie, it's been a delight to have you to chat with. Thank you so much for your presentation, and enjoy the rest of your day. And thank you again.
Thank you very much, Dave.
So there's Sophie Smith, who joined us. If you want to watch Sophie's presentation again, you can on the Future Health YouTube channel. And of course, there may well be a conversation going on using the hashtag Arab Health Week on all of our social media channels. So one more presentation to go for today, but of course then we've got all of tomorrow and Thursday as well, lots and lots going on. Our final presentation is from David Boucher. David is Chief of Service Excellence at Astra DM Healthcare, and he's going to be talking about the importance of digitisation and service excellence for medical value travel customers. And here is David's presentation.
Hello, everybody. My name is David Boucher. I currently serve as Chief of Service Excellence at the corporate level at Astra DM Healthcare, physically, geographically located here in Dubai, the United Arab Emirates. Today, we're going to talk a little bit about the importance of digitization and service excellence for medical value travel consumers, or medical tourists, basically. I want to start off by sharing with you that I'm going to share a number of initiatives that we have going on at Astra DM Healthcare. Some are in an iterative fashion, so we are, again, a body in motion, and we are not where we aspire to be exactly, but we're working hard to get there. I'm going to first share with you a few things about Astra DM Healthcare. So first, from the service excellence perspective, for this whole pillar within our organization, we actually have a mission statement, and that is to establish Astra as one of the most sought-after healthcare providers globally by creating a seamless, unforgettable experience for our patients, visitors, and family members. So a pretty ambitious goal, if you will. A couple of slides about Astra DM Healthcare from a high level. So today, we currently have half of our hospitals and half of our facilities are in GCC in the Gulf region, and the other half are located in India. And as you can tell from this screen, we have 26 hospitals total. 13 are in the Gulf region, and the other 13, again, are in India. 115 clinics. 225 pharmacies, a total of 365 facilities, but of course that number is increasing as well. A couple of important things on this slide. In the current year, we'll actually treat over 20 million total patients, and we have close to 19,000 Asterians working across all of our organizations. Next, I want to share with you a little bit about the whole patient experience and the role that we think that technology is playing today and will play in the future. So some of the goals specifically that technology can assist and can enable to help us improve the patient experience are specifically improving the measurement, right? So we want to measure as much as we can, as quickly as we can. We think it will help us improve our patient experience and the whole consumer engagement, if you will. We believe that increased the patient experience will actually improve our healthcare outcomes and our patient care. And again, on this whole journey, we are very much a work in progress. We are really in some of the first steps of this journey. But I will tell you that on the measurement side, that we understand, we believe that what's measured can be improved, and of course, what's rewarded can be repeated. So there's a number of elements that we've developed and are in the process of developing in-house to develop and improve our whole voice of customer platform. We're focusing, and we're currently at 100% digitization. We actually seek data and get data, patient feedback, consumer feedback from 11 different channels. So things like mobile tablets at the bedside. We have QR codes throughout the facilities, both our outpatient clinics and our hospitals. We have a number of kiosks throughout our facilities as well. And unlike some hospitals, we actually require people to use them to actually give us their mobile telephone number. So we just don't want a little child there sitting and pushing a smiley face for 100 times. So we require that. And of course, we utilize that information to improve the patient journey. So in addition to the kiosks, we also, of course, use Google ratings and things of that nature. We have 45 different cuts of the data that are available. We also send out SMSs. And as you can see, we get about 3% collection feedback specifically from messages, from SMS. From inpatient, we entrap information and feedback from about 55% of our inpatients across the organization, and about 11% on outpatient. Now, we think at 11% on one hand is higher than average, but we really would like to see it get up closer to 20%. And we have found that the number one way to improve our collection rates is to ensure that our consumers know that we're listening to what they're telling us and we're making changes along the way. And then we centralize a lot of this information in a dashboard based on your different levels in the organization. So we actually have real-time dashboards that as surveys are coming in, those are updating. So specifically in measuring the voice of our customer, some of these statistics come from our Medcare division here in Dubai. So this is about 24,000 total inpatients year, greater than 1 million outpatients. As you can see here, over 250,000 meals served. And again, we're trying to capture up to 80% of our inpatient, and again, 5-10+% of our outpatients. Now, over time, we've been challenged, as you see on the far right. We had a manual process with relatively low capture rates. We had no complaint management system, no data, no query management system. We had very poor accountability. And so because we had really a poor measurement, we did not have a lot of patient engagement and stuff. But all of that is changing, as you'll see. So right now, our focus is to really develop a multi-channel digital patient experience with live dashboards, as I mentioned prior, increased accountability, of course, throughout the organization. If we get a signal from a patient about something that needs to be fixed, if it goes, depending on what exactly it is, if it's more than 30 minutes, it goes up directly to the hospital COO or CEO to address. And then finally, in the bucket, it's about rewarding and recognition. So we know, again, as I mentioned previously, that we know that what's rewarded is repeated. And so one of the things that we're doing is we're getting creative about our recognition program. So moving on, I wanted just to share with you, illustrate some of the dashboards that we're using as we measure this voice of consumer. So we actually have a total of more than 50 dashboards that are available on the application that we're using with a number of different multiple data cuts. So basically, this is Moneyball 101. You can really slice and dice and look at the data about any way you want. Specifically here on the screen, what I'm sharing with you is Net Promoter Score. So as the Net Promoter Score is changing throughout a day, throughout a week, throughout a month, throughout a quarter, the end user can see that. Our overall patient satisfaction, our expectation management, again, is important. Again, our Net Promoter Score. Would you be willing to refer our facility or our outpatient services to family and friends? Again, we have digitized our complaints, suggestion, and compliments, and with a much greater emphasis on compliments, as you might imagine. And again, we're looking at this data through a number of different channels. But we also look very specifically at the number of irritants. One of the things that we've learned specifically from the Ritz-Carlton organization, the Ritz generally only looks at 20 and measures and really looks at only 20 main elements because they know that if they focus on and improve those and keep those 20 at a very high level, that they basically have increased occupancy in their hotels and they can actually charge a little bit more as well. So we're not quite at 20. We have a few more indicators and bogeys that we're looking at, but that's, again, where we aspire to be. On this slide, what this slide shares with you, again, is some of the specific dashboards that, again, the department managers, the service excellence staff, the chief operating, the chief nursing officer in our facilities have as well. And as I mentioned a couple times already, again, these numbers are not what we aspire to be. We're a work in progress. We've had this system running for under a year now. But so far, we're pleased with the progress. And one of the things that I try to impart to my staff and to our teams here is that we are focusing on progress, not perfection. We can make a little bit of improvement every single day, every single week, every single month, every single quarter. We're continually going in the right direction. So specifically, on patient satisfaction, again, taking into account, we basically ask the question, as you can see here, taking into account your overall healthcare experience, are you satisfied with your experience? Next, from a Net Promoter Score, how likely are you to recommend us to friends and family? On the loyalty meter, how likely are you to continue to choose our Medcare hospital or clinic the next time you need medical care? And then finally, from an expectation management, was where our staff, the ability of our caregivers, were we able to meet or exceed your expectations? So those are the four main areas that we're focusing on. One of the initiatives that I wanted to share with you today is something that we're about halfway implemented throughout our Medcare division. And that's a service, a product we call OneTouch. And these are basically bedside tablets that we have throughout the hospital. And one of the things we realized is when we went through and enumerated and really analyzed the data, we found that about 35% of the inquiries that our patients were hitting the nurse call bell, about 35% of those had nothing to do with nursing. So we developed using an app, the bedside app called OneTouch, and really allows the patient to have much greater control over their room temperature, their need for water, if they need housekeeping, if they have a problem with the television set. We have smart TVs in our hospitals, or do they have a problem with Wi-Fi, right? Those inquiries go directly to the people who can help them. And one of the things that we found out is that this tool can help us save upwards of 35% of nursing time. Now, increasingly, our hospitals are working in a DRG environment. And one of the things that we know, about 10 or 15 years ago, an article was published in the New England Journal of Medicine, which statistically indicated and illustrated that an increased amount of nurse face time that patients have with nurses, actually they heal more quickly and they're discharged from the hospital sooner. So what we're trying to do is free up as much as our nurses of their time with administrative tasks so that they can focus more on what they really were trained to do, and that's taking care of our patients and our consumers. So again, if we can implement this throughout and improve our nurse productivity by 35%, we want to try to do that. So the next slide here basically shows you, it's a screenshot of what this looks like. So as you can see, the patient can push on if they need something with food or linen or their room temperature, television, or whatever. They can basically do that. Again, it goes right to the department, right to the person who's on call, who can help the patient with that. And if it's not tended to within 15 or 20 minutes, again, their supervisor or manager gets a signal on their phone, and eventually we have thresholds set up. They go directly to the COO or CEO of the hospital. So this really allows us the need for the patient to touch one time, and it prioritizes exactly what matters. So I want to make the jump from what we're doing with OneTouch into the whole area of medical value travel. Some of the things that a lot of folks may not know, obviously in the COVID world, we're not actually in the post-COVID world yet worldwide. But one of the areas that we know is that Dubai is a really, really interesting place with a number of different nationalities living here and traveling here. But one of the things I want you to know is that Dubai is absolutely open for business, right? So this is a brand new website that we've recently launched, astromedicaltravel.ae. It's intended to be a one-stop shop for medical travelers, for employers, and for medical travel facilitators. And oftentimes our chairman likes to basically share the analogy that if you're looking for business class or first class, you may want to go with the Medcare brand. If you're looking for coach or premium economy, you may want to go to our Astra brand. So from both of our brands, you're able to go to the same site and you can pick based on price and other product differentiations. And it's pretty interesting. There's not a lot of other provider groups offer that. In fact, nobody that I'm aware of. So again, I want you to know Dubai is absolutely open for business for medical travelers. And I will share with you an interesting statistic. In the last 3 months alone, when many countries around the world have their borders closed, we have treated here in Dubai in our Astra and Medcare facilities patients from over 152 countries around the world. So a pretty significant number. We see that increasing as well. The next couple of slides simply are screenshots of this Astra medicaltravel.ae website. Again, this one illustrates that, in fact, one of our core beliefs, we believe that doctors and, in fact, nurses are our life force. And we believe that in designing hospitals we do so to really maximize the whole healing process. So our VIP suites and royal suites and things of that nature, you'll see they're really very nice from a luxury perspective and stuff. So next, I want to share with you a little bit about what we're doing with technology also to improve the whole patient experience. And that is, we've recently launched our One Astra mobile app. So if a consumer today goes out here in Dubai, goes into the Apple store, and basically looks to download an Aster app, you wouldn't really necessarily know exactly which one to download. There are a number out there. But in a relatively short period of time, within a month or two, that's going to change. And there'll be only a single one Aster mobile app. And right now, this allows us the ability, and again, this is all a work in progress as well, but patients from really anywhere in the world, they can basically go out. We're using this. The first launch is for telemedicine visits, telehealth visits with different specialists. I'll share a little bit about that on a subsequent slide. So patients then can go out, they can read the bio of the physicians, find out perhaps how many procedures that they've done, and they can actually go ahead and make an appointment booking right through the mobile app. And over the next several weeks and months ahead, we'll be having additional releases on this on one Aster mobile app on a pretty regular basis. So think in terms of your results reporting, where patients can go out and get lab results, radiology results, and other, cardiology, some of the other things as well. But then also e-prescribing as well. As I mentioned in one of the earlier slides, we have several hundred pharmacies throughout the GCC and increasingly in India as well. So patients will be able to utilize the e-prescription. So specifically, as I mentioned, the initial rollout, the main, in addition to appointments and appointment booking in one Aster, is Aster Telehealth. And so it's for so many ways, the pandemic going back to Q1, Q2 of 2020 really enabled Aster DM to delve into the whole telemedicine area, foray, if you will, in a very, very large way. So if you can see from this slide, so far to date, we've end-to-end, we've provided over 160,000 teleconsultations over the last 8 months. We have 53 specialists that are available 7 days a week that are available. We've provided care in 5 countries, patients from where the majority, obviously, of our hospitals are. We have over 800 distinct physicians working amongst Aster that are regularly involved in the Aster telehealth. So the whole focus for us, of course, is that we have a total seamless integration with hospital care. So back to the whole medical tourism, medical value travel. So pre-service and post-service, patients, consumers, once they become patients, are able to connect with their physicians pre and post surgery in right through this app, and everything is all handled into a single EMR. So today, and one of the things that we think is that that right now, one of our Aster or Medcare physicians can really is the furthest away they are is 83 centimeters, and that's the length, the average length of a human arm. And so if you can push the button and you can have access to one of our physicians. And finally, one of the things I want to share with you specifically that ties all of this together is that Aster has embarked on a mission. Our brand is spreading into the Western Hemisphere. We are in the process of building Aster Cayman MedCity Hospital in the Cayman Islands, in the Caribbean, the Western Caribbean. We absolutely intend for this to be Western Caribbean's most technologically advanced hospital. We will have the only NICU, neonatal intensive care unit in the Caribbean. And this is going to be really in a several phase project through 3 main phases. So you see here an artist rendition of the hospital. We are breaking ground on this facility over the next 60 to 90 days, and it'll be finished either sometime at the end of 2022, early 23. But in addition to the hospital, again, multi-specialty, very high tech, the next phase of this project will be an assisted living program as well. And so you see here housings, and so it'll be on the assisted living facilities, and step down will be on the same campus as the hospital and our restaurants and everything else, along with retail. And then finally, in phase 3 of this whole project, we'll actually be building a medical school. As you see, it says Healthcare University, very similar to one that we've also started years ago in southern India, in Kerala. And so we're excited about this as well. We know that we need to increase the number of physicians worldwide, certainly in primary care, intensive care, intensivists, but specialties as well. So we're pretty excited about this, and we know that when we're done, when this hospital is opened at late 2022 in 2023, We know at that point that the sun won't set. The sun will never set on the Aster brand. And so we'll continue to expand that. The Cayman facility will almost significantly be medical travel, the facilitator, medical travel patient-centric. So we're looking obviously for patients to be visiting us from North America as the cost of healthcare continues to climb in America, as the queues continue to climb, both in Canada and in Great Britain. We think this is going to be an interesting opportunity for us. In addition to, of course, Central America, patients coming from South America and the Caribbean as well. So with that, I thank you very much for your time and attention. I'm happy to answer any questions now, and we'll open that up. So thank you very much and have a great day.
And here is David now to answer your questions. Good to see you, David. How are you today?
I'm well, thanks, Dave. Hope you're doing well.
I am. I mean, we've all been focusing on our health. We've been forced to, haven't we, in the last 12 months? I don't think there's ever been such a focus. Some people are ignoring it. When you look at some of the statistics that say you should look after yourself, maybe lose a bit of weight, maybe have a better diet, do some exercise, things like that. Some people are ignoring it, but there is this massive focus, and you're absolutely right. With the queues, people will have to look elsewhere. And you were very upbeat and optimistic about that.
I am, Dave. I think if you look at some of the interesting things that are going on right now, I mean, we know that, for instance, Dubai, there are 2/3 of the world's population is within an 8-hour flight of Dubai, right? Number one. Number two, another point I made during the presentation is so far, just in the last 3 months, we've treated patients from 153 countries around the world. So Dubai's open for business and things. I think that increasingly, because there is pent-up demand in a number of countries for a number of reasons, but you bring up a really, really good point, Dave, and that is about wellness and take care of yourself. And I'll admit in a public domain like this, I contracted COVID back in early March, and I had no idea that I had it. I'm a daily runner. I run 5K just about every day, and I went to get my pre-flight COVID test before coming from Florida, from South Florida to Dubai, and I actually tested positive, and I was amazed. I said, it can't be. I was totally asymptomatic. The reason I bring that up is not to be boastful, but it's just to share with you, to reinforce the point you just made, is that I think it is important for us to take care of ourselves, and we know that the greater we take care of ourselves, the less impact that diseases like this, viruses like COVID are going to have on our bodies. So, I think it's a testament to good living. And I think increasingly patients are going to access Aster DM and our different verticals for the different wellness services that we offer.
Yeah, wellness. I mean, and well-being, both physical, mental. It's an interesting topic, and it brings in a lot of other agencies and partners. Some smaller ones, some larger organisations. I too had COVID quite seriously back when it was first sort of breaking in the UK. And I, like you, think of myself as a fit guy. And I often look back and think, did I survive because of that investment in my health? Following a Mediterranean diet, doing some aerobic exercise. I guess I'll never know, but it certainly hasn't hindered me. I can't imagine, and I'm still in recovery now. Some questions from people who've been joining us, David. It says here,
sure.
With such a large app development, how long did it take to roll out, and what is the plan for future rollout?
Sure, great question, and happy to answer. We actually looked at 2 or 3 different platforms upon which we're using right now, and I'm happy to mention the vendor's name. I didn't in the presentation for obvious reasons, but the whole dashboard system that we use to collect all the 11 different channels of information on the whole patient journey is called DreamSol. It's based out of Mumbai, India, so you can research that. Happy to send information. The One Touch at the bedside, I talked a little bit about that. Where the patients basically can bypass the nursing for things like air temperature, or their Wi-Fi is broken, or they'd like something to eat. We use a company called Treatwell. They're also an Indian-based company, and again, happy to share the details for that. The actual mobile app, the One Aster, that we've actually developed that ourselves, that we're introducing. So I talked about telemedicine and the visits and some of the things that we're moving forward to with patients being able to access their test results and things of that nature, and make payments and all that. That's something we've done internally. So 3 separate platforms that I discussed.
When we start to look at patients as customers, clients, people who we need to treat well, like you would as a hotel guest, as you mentioned, do you incentivize, or do you propose to incentivize staff to look after these people, or do they see that as part of their role?
They don't yet. So a couple of times during the presentation, Dave, I mentioned the phrase that we're focusing on progress, not perfection, right? We are not what we aspire to be. We're definitely a work in progress. But both of those things you just mentioned is absolutely, we expect to get there. So 2 things. Number 1, we know that what's rewarded is repeated. And we're actually in the process right now of developing some programs that we will reward staff if they are specifically called out by name in our patient satisfaction survey. That's really important, right? We want to focus on the positive, and especially, some of the caregiving links for sure. I mean, so many times our frontline nurses hear the negative and the lab techs and things about how they could have done better and should have done better and everything else. But we want to really, really enforce the positive. And then the second thing you mentioned was about, gosh, I forgot. About doing the same thing, about expecting and improving the whole patient journey from a hotel perspective. No secret, we are actively recruiting patients from some of the top hotel brands like the Taj Hotel, the Oberoi, the Ritz-Carlton, from some of the airlines, and the Emirates Air. We've recruited staff in the last 3 or 4 months, Qatar Airlines. And so we need to make that pivot. We can't obviously replace all of our caregivers from the hospitality side, but we're trying to vacancy by vacancy to see if we can add that complement for sure. It's a totally different way of thinking.
It is, and maybe that relates to this question. Do you think people's expectations have always been traditionally low of healthcare services, and that this is going to come as a bit of a surprise, that actually they might get a meet and greet package, they might be offered a coffee and somehow a choice from a menu, and all of these things that potentially could come in? This is going to come as a bit of a surprise because expectations are traditionally low, aren't they?
They absolutely are. And as you point out, most patients, if they're not going for wellness, for cosmetic surgery or something like that, don't really want to come to a hospital. You don't really want to be in a clinic, right, for a number of different reasons. And so that's exactly the case. So what we try to construct here and try to work with our staff is, meeting the customer's expectations is a pretty low bar, right? That's what you just mentioned, because the expectation level is not very high. So we have to meet their needs and exceed their expectations. That's the goal. We're crystal clear on that. And so not to be confused with Crystal Palace, but crystal clear on that we need to exceed our customers' expectations. So.
And of course, I mean, it sounds like you're making great progress, and we'll talk about the future in a minute, but of course you're still playing catch up because other industries have been doing this for years, haven't they? Online reviews, forums, communities where you can share your opinions, that sort of thing. Bit of late to the table, but better late than never.
No, you're absolutely right. So we look at our Google ratings in real time. Our real-time dashboards, we're monitoring those. Again, we're maybe 4.1, 4.15, 4.2. We think we can do better. We're going to certainly strive to do better. But as you know, Dave, once you get to about 4.5, 4.6, it's really, really difficult to move the needle that last measure. But we're going to try for sure. So we're doing a number of things that I've talked about today.
Sure, and I guess that it could be frustrating, so that it depends where you're located in the world, in a particular region, in the country that you're in, that you might see that one service provider is providing brilliant care, your provider is pretty poor, but you don't get a choice because you have to go to the local provider, and they're dragging their feet. That's a challenge.
Yeah, it is a challenge, and I think. But I believe that consumerism is king, right? I believe that the educated consumer will be Aster's best customer, right? And I think so. We're absolutely a work in progress, and we know we can create stickiness really by exceeding the customer's expectations. They'll want to come back, And that's the case. I mean, we have certainly a high percentage of loyal customers and loyal patients. But one of the things that I try to drive home on a pretty regular basis is that we have competition, right? Dubai is a very, very competitive market internationally and on here just internally in the UAE. And so we have to remember that, and we have to honor our customers by trying to every single day get a little bit faster, get a little bit better at what we do. I'm convinced that over time, that I refer to this as the 3 S's, Dave, that first and foremost, patients will go to where the safest care is, second, where they get the best service, and the third will be savings from a cost perspective as well. But some people obviously travel for savings for price first, but I think increasingly through the transparency of data, I think safety is going to be number one.
Yeah, I think that's a brilliant way to summarize that. I mean, in terms of you mentioned not perfection, but progress over the next few years. Things have moved rapidly in the last 18 months, 2 years. What do you see happening over the next 5 to 10 years in the field of health tech?
Gosh, it's wide open. I think one of the things that the pandemic has taught us is that a lot of employees who we used to thought had to work at the hospital now we know can work at home. So that offers up a ton of opportunities for outsourcers and in-services and insourcers. And I think telemedicine and at-home monitoring and everything else has taken off. And I've been a fan of telemedicine since the late 90s. So it's really, really nice to see where this has grown. You know, we may not go back to the level we were at the height of the pandemic, but a lot of people who have experienced telemedicine visits around the world are very, very satisfied with that. And it's been a huge boost. So I think it's a positive thing.
Brilliant. Well, it's been an absolute pleasure to chat with you and hear what you've got to say. Like all of our presenters today, it feels like you're positive, you're upbeat, and considering the last 12 months, that's an absolute delight to hear.
You bet. Well, thank you for the opportunity. I can tell you at AstraDM Healthcare, we have used the last year plus, and we have worked really, really hard. You know, we've taken care of our employees the best that we possibly could and our patients and everything else. But we've used the time and we've used virtual platforms, but we've a lot of initiatives in place. So it's quite frankly, it's a very, very exciting time to be here.
Brilliant. Well, it's certainly focused minds and hearts as well. David, thank you again for joining us. Enjoy the rest of your day. And maybe we'll get the chance to chat again soon. That's
you as well.
David. Thank you. That's David Boucher there, who joined us for his presentation. So there we go. That's day one's presentations wrapped up. What a day it's been. We've learned so much together. You can stay on the platform, of course, to share your own best practice, to chat, and of course to connect with others. Networking is the key. Remember, we're all about building a community of healthcare professionals, not just in Dubai, the UAE, but worldwide. And let's say that the pandemic certainly seems to have connected the world in many, many ways. And we are here to do that as well. We'll be back tomorrow. Of course, we're into day 2. There's a 3-day event at Arab Health Week. You can stay on the hashtag. Arab Health Week is the hashtag that we're using on social media. Keep the conversation going. Raise your points. I'll be back tomorrow. Let's take a little look at tomorrow's program, shall we? So in the morning, we have the role of the vaccine as the best hope to end the pandemic. That's Katabi Al-Manassir, who will be presenting that session. That'll be followed by the healthcare app development and non-traditional appointments by Abdulaziz. He'll be talking about that in the afternoon. We've got people from the World Health Organization, Michelle and Dr. Ahmed Hankir, who will join us for a fascinating insight into their roles. And finally, we have our tech panel, the mental wellbeing trends in health tech. That panel is Kieran, Hazel, and Ezra, and they'll be there in the afternoon. So there we go. Stay on the platform until we close in around about half an hour's time. Jump on that hashtag. Let's see you then. But for now, I've been Dave Sharp, your host. Been a pleasure to be here today. Look after yourselves, and we'll see you back here tomorrow at 10:30 for day 2 of Arab Health Week.